I'm Trisha Prokop, a student at the University of St. Augustine in the Doctoral of Education program. Thank you for watching my second video, part 2 of a teaching externship. As a quick review, this is the second of a series of 3 videos describing an assignment that I did as a part of a teaching externship. In the first video, I shared an overview of 2 teaching objectives that I had for myself while giving a lecture on lumbar examination to graduate students in a DPT program. I also introduced 2 learning theories that I implemented to address the objectives. In this video, I will describe the application of the 2 learning theories, information processing and Vygotskianism, in a lumbar spine examination lecture. As a review, the 2 teaching objectives that I set for myself were to clarify previously identified systematic errors and to assist students in the ability to apply the examination principles of 3 orthopedic theorists to the examination of the lumbar spine. I broke the 45-minute lumbar spine examination class up into 2 parts to address each of my 2 teaching objectives. During the lecture portion of the class, I attempted to clarify a previously identified systematic error using the learning theory of information processing. The systematic error was that students had significant difficulty remembering a diagnostic system known as the treatment-based classification system. The second portion of the class was dedicated to group work on patient cases to allow students to apply the examination methodologies of 3 theorists to the examination of the lumbar spine. The emphasis during this portion of the class was on Vygotskianism. The focus of the lecture was on the treatment-based classification system, which was described in the article, Clinical Examination Variables Discriminate Among Treatment-Based Classification Groups, a Study of Construct Validity in Patients with Acute Low Back Pain, by George and Delito, which was published in Physical Therapy in April 2005. Table 1, which you see here, is from the article and was used as the structure for the lecture as it provided a clear organization for presentation of the classification. Here you can see an example slide from the lecture, which pulled out a section of Table 1 from the George and Delito article. Using this slide, I emphasized that with the treatment-based classification system, patients are classified based upon how they are treated. As an example, patients are classified into the extension syndrome if they are treated with extension exercises. We further discussed the key history and clinical findings which supported the classification. After breaking down each classification, I displayed this slide, which lists all of the lumbar spine pathologies with which the students were already familiar, and asked the students to identify which pathology, if any, could be placed into the previously discussed classification based upon the key history and clinical findings, as well as the treatment. As discussed in the first video segment, the emphasis of the information processing theory is on breaking down the thought processes of experts to allow for specific instruction. As we learned through the Foundations of Teaching and Learning course created by Professor Dan Lofold, there are 3 necessary components to this process. First, we must know the knowledge that we want students to acquire. Second, we must know the initial state of the student. And third, we must know the processes that occur in the instruction of the students to allow for the transmission of the knowledge. In my example of the lumbar exam lecture, I knew that I wanted students to acquire the knowledge of the treatment-based classification system. I knew that they had never been exposed to the treatment-based classification system, but they did have knowledge regarding lumbar spine pathology, as well as key history and examination findings of other areas of the spine. Third, I wanted to emphasize the information processing flow to transmit this knowledge to the students. The information processing theory emphasizes the flow of information from the environment into the semantic memory. In this example, the students were in a lecture environment with various information impacting their sensory systems. My goal was to increase their attention to relevant aspects of the treatment-based classification system by displaying only small sections of the system at a time. I know that the capacity of our working memory is limited, and therefore it is not appropriate to expect students to memorize the details of each individual classification system. Instead, I attempted to chunk the information into useful bits by emphasizing how the classifications are based upon treatments. Finally, I know that information is stored in the semantic memory as meaningful information. In order to apply meaning to the treatment-based classification system, I wanted to connect this new system to previously learned information by linking the classifications to pathologies of the spine, which I knew was baseline knowledge that the students possessed. I had previously identified that students had difficulty remembering the treatment-based classification system. Therefore, I spent the first part of the lumbar examination lecture applying the information processing theory to assist students in acquiring knowledge about the treatment-based classification system. The second part of the lumbar examination lesson addressed my second teaching objective through the use of Vygotskianism. After spending a bit of time reviewing the fundamentals of each theorist's examination techniques, students self-selected into groups of 4. 2 groups were assigned to each of the cases seen here. Students were asked to create a case presentation for each diagnosis in accordance with the assigned theorist's views. After approximately 10 minutes of group work, during which time I was floating between groups to listen to the dialogue and answer any questions, we reconvened as a class to present the cases. Groups presented their patient cases along with positive examination findings. According to Professor Lofold, the levels of processing theory tells us that there are different ways to code to-be-learned information, and memory codes are qualitatively different. It was my hope that by asking students to create and present their own cases, the information would connect to high-priority nodes via ego involvement, and therefore enhance the depth of their learning with an increased ability for retrieval of the information at a later point in time. As we recall from video segment part 1, Vygotskianism emphasizes that the origin of knowledge is in the society in which the learner is part, and meaning is constructed as social language allows. Therefore, the emphasis of the case presentations was on the dialogue. My role was to ask questions of various students in the class so as to encourage as many different presentations and descriptions of cases as possible. I also asked many why questions so that students would not only have to present their case, but also verbalize their rationales for the positive findings that were presented. Lev Vygotsky defined the zone of proximal development, where the lowest limit of the zone is what students can accomplish independently. The upper limit of the zone is what each student can accomplish when supported by a more knowledgeable other. It was my intention that within each group, the more knowledgeable other would assist other students into working towards the upper limit of the zone. In addition, when we rejoined as a class during class discussion, it was my intent that other students as well as myself could serve as the more knowledgeable other. As a review, the lumbar spine examination class was broken into 2 components. The first was a lecture to clarify previously identified systematic errors through information processing. The second was a case discussion with the emphasis on Vygotskianism. I would again like to extend special thanks to Professor Dan Lofold at the University of St. Augustine, as well as Professor John Leard at the University of Hartford, and the students of the Musculoskeletal Dysfunction 2 class, fall of 2014, for assisting me in this project.